Did you know that diabetes can present itself in various ways? There are some common symptoms that often show up at night, indicating that someone might have pre-diabetes or early-stage diabetes. Do you know what they are? This is crucial because many people with diabetes are unaware that they have the disease. Diabetes is treatable, and in many cases, it's possible to reverse it. So the sooner you find out, the better. By discovering that you have pre-diabetes, we can prevent you from becoming diabetic. And if you already have diabetes, we can help you avoid all the complications associated with it, which, as you know, are terrible. But first, start by liking the video. Let's aim to make this video one of the most liked on the channel. Help us out! Also, share this video with your friends and family. By sharing, you'll be helping more people. So spread the word! And tell me, do you have diabetes or pre-diabetes? Where are you from? Write it down below. What is pre-diabetes? It's when blood glucose levels are higher than normal, but not high enough to be classified as diabetes. Normal fasting blood glucose is up to 99 microdl. If your fasting blood glucose is between 100 and 125 microdl, you are considered pre-diabetic. Additionally, if your glycated hemoglobin, HbA1c, which is the average of the last 10 weeks, is between 5.7% and 6.4%, you are also in the pre-diabetic range. Diabetes is diagnosed when fasting blood glucose levels are 126 microdl or higher, or when HbA1c is 6.5% or higher. Now, what are the most common symptoms that diabetics and pre-diabetics often experience at night? Let's go through the 9 main symptoms. First symptom, frequent nighttime urination, nocturia. If you previously slept through the night but now wake up 2 or more times to urinate, it's a good idea to get your blood tests done, especially fasting blood glucose and HbA1c. Could it be something else? Yes, it could be a prostate issue if you're a man, or it could be sleep apnea, which makes your sleep more superficial, causing you to wake up frequently. It could also be due to drinking a lot of water, tea, or coffee before bed, or even taking medication that increases urination. However, one of the main things you should rule out is diabetes. High blood glucose levels draw water from your cells, making you thirstier and causing you to drink more fluids. This, in turn, makes you get up to urinate more often at night. Second symptom, blurred vision at night. If your blood sugar is higher than normal, it can affect your vision, often manifesting when it's getting dark or during the night. Are you having difficulty driving in the late afternoon or at night? Blurred vision is a common symptom of diabetes. High blood glucose levels can cause an imbalance in the fluids inside your eyes, leading to swelling and changing the shape of the lens. This affects your ability to focus correctly. Moreover, diabetes is the leading cause of blindness in adults due to diabetic retinopathy, which occurs when blood sugar levels remain uncontrolled for a long period, damaging the small blood vessels in the retina. While blurred vision isn't exclusive to diabetes, it's essential to get regular eye exams, especially if you are diabetic, to detect any related issues early on. Third symptom, nighttime leg cramps. Leg cramps can be very annoying, and diabetics are more prone to experiencing them at night. Several factors contribute to this. 1. Dehydration caused by high blood glucose levels. 2. Electrolyte imbalances. High glucose levels can affect potassium, magnesium, and calcium levels, which are crucial for muscle contraction. 3. Circulation problems. Poor blood flow delivers less oxygen and nutrients to the leg muscles. 4. Diabetic neuropathy. Diabetes can damage your nerves, affecting their ability to send proper signals to your muscles, resulting in cramps. Fourth symptom, burning feet. Do your feet feel like they are burning at night? Sometimes this sensation can be so intense that it disrupts your sleep. This burning sensation can extend to the entire foot area, including the sole, toes, and top of the foot. It's often very uncomfortable and can cause increased sensitivity to touch. Diabetes can cause nerve damage, known as diabetic neuropathy, which can affect up to half of people with diabetes. There are some vitamins that can help improve this condition, and I will leave a link to my video on vitamins for diabetics at the end of this video. Fifth symptom, morning fatigue. If you wake up tired and without energy, even after a full night's sleep, it could be a sign of diabetes. Uncontrolled blood glucose levels can affect sleep quality. If blood sugar levels are too high or too low during the night, it can cause sleep disturbances, leading to frequent awakenings and resulting in morning fatigue. Diabetes is also associated with a higher risk of developing sleep apnea, a condition where breathing stops intermittently during sleep, which can be very dangerous. Up to 50% of people with diabetes may have sleep apnea, often without realizing it. Sixth symptom, intense hunger at night, nocturnal polyphagia. If you feel an intense need to eat at night, even after a balanced meal, it could be a sign of diabetes. High blood glucose levels make it difficult for the body's cells to use glucose as an energy source. As a result, the body interprets this lack of energy as hunger, causing you to raid the fridge at night. Additionally, excess insulin in the blood, often due to insulin resistance, can lead to hypoglycemia, a drop in blood glucose levels, triggering intense hunger. Seventh symptom, night sweats. If you start waking up with wet clothes or sheets, it could be a symptom of diabetes. When blood sugar levels are high, the body tries to excrete the excess sugar through urine or sweat. Diabetes can also affect the autonomic nervous system, which regulates sweat production. Hypoglycemia and sleep apnea can also cause night sweats. Eighth symptom, bad breath. Diabetes can lead to dehydration, which causes dry mouth and worsens bad breath. However, bad breath that smells like fruit or acetone can be a sign of uncontrolled diabetes, known as keto breath. This occurs when the body burns fat instead of glucose for energy due to a lack of insulin. When ketone levels in the blood increase, the breath acquires a characteristic odor, indicating the presence of excess ketones in the body. Ninth symptom, restless legs. You might not feel pain, but you may find it difficult to find a comfortable position for your legs at night, feeling a constant need to move them. Diabetics are at higher risk of restless leg syndrome, which tends to worsen at night. This could be due to diabetic neuropathy, changes in dopamine levels, poor circulation, or nutritional deficiencies, especially low iron levels. So you've taken a blood test and found out you're pre-diabetic, almost diabetic. Now what? How can you prevent pre-diabetes from turning into diabetes? A study called the Diabetes Prevention Program, DPP, involved over 3,000 people with pre-diabetes. They were divided into 3 groups. 1. Lifestyle changes. This group aimed to lose 7% of their body weight, consume fewer calories, and exercise for 150 minutes a week. 2. Metformin group. This group took 850 mg of metformin twice a day. 3. Placebo group. This group received a placebo pill. Which approach was the most effective? The lifestyle changes group, which focused on eating right, cutting out sugar and soft drinks, and losing weight, reduced their risk of developing diabetes by 58%. The metformin group also showed a significant reduction, lowering their risk by 31% compared to the placebo group. So if you're pre-diabetic or diabetic, I recommend checking out my special diabetes playlist and my video on vitamins for diabetics. If you enjoyed this content, please like and share the video. Remember to subscribe, and thank you for watching. See you in the next video. Stay healthy, stay happy.